Sexually transmitted diseases are caused by infections that are passed from one person to another during sexual contact. There are many kinds of sexually transmitted diseases and infections. In Grenada, some of the most common types of STIs include gonorrhea, chlamydia, and syphilis. Gonorrhea is an infection caused by a kind of bacteria that is passed during sexual contact. It's sometimes called the drip or claps. Gonorrhea can be a serious health risk if it is not treated.
Gonorrhea is very, very common. It is caused by a bacteria, and Neisseria gonorrhea, the name of the bacteria. And as we said earlier, it's transmitted from one person to another through sexual contact. That being said, one will now be able to understand how or the extent to which one could be at risk of it being transferred, because sexual contact can be all forms of sexual contact, and that would be things like vaginal intercourse or anal intercourse or oral sex. So whichever part of your body that you use in sexual activity, that part of your body is at risk of being infected with gonorrhea and other forms of sexually transmitted infections.
Gonorrhea often has no symptoms. A healthcare provider can do a simple test to confirm a diagnosis.
With so many sexually transmitted infections, the early signs and symptoms are none at all. In fact, the thing we call the incubation period of gonorrhea, an incubation period simply means the time it takes for someone to manifest the disease after they have gotten that infection. The time for manifestation of the disease can go anywhere from 1 to 2 weeks, sometimes even 3 weeks. So many persons having those infections are not even aware that they have it, and when they start manifesting the disease, some of them don't even remember where they first had those contacts. So the point is, don't wait to see signs and symptoms before you get yourself checked. But if you do wait, you may have to wait for some 1 to 3 weeks before you actually see the effect of it. Almost all the guys who've had this will be able to experience pain and burning sensation when passing urine. They may also notice a kind of whitish discharge from the penis. Some gentlemen may not even see the whitish discharge, but have noticed that their undergarments are being soiled when they wake up in the morning, see something funny in their underwear. Those are some of the signs and symptoms. If they ignore that, the infection can spread to the other parts of the genital organs, including the scrotum, and they may experience a lot of pain in their scrotal sac, the scrotal area. They have swelling and fever and abdominal pain and back pain. But the truth is, most guys never get to that level of symptoms because they rush to the doctor but the first time they see something happening at the tip of their penises. So that's fine. My heart goes out for the female though, because because of how the anatomy of the female genital organs is made, they have the ability to keep that infection inside of them. And so many ladies have that infection in there, and some of them may not even have any symptoms, as I said earlier. But if they do have symptoms, they would experience, again, lower abdominal pain, abnormal bleedings from the vagina, fever, back pain, burning sensation when pass urine, and pain during sexual intercourse. I mean, some ladies do experience pain during sexual intercourse, but I'm talking about severe pain on deep pressure or deep protrusion of the penis into the vagina. So if you're having lots of unreasonable pain during sexual activity, that's an indication that you may have had a gonorrheal infection. Most doctors can diagnose gonorrhea from physical examination, from taking good history from a patient and looking at the discharge and so on. But we're living in an age of technology, so it could be diagnosed using special types of tests, blood test or something we call a swab, where you take a specimen of the discharge and grow it on a special agar plate, and you can actually see the bacteria underneath the microscope. And by and large, this is how we do it here.
Antibiotics are prescribed to treat gonorrhea. The disease does not easily go away. Healthcare providers will decide on the best treatment. Both partners must be treated for gonorrhea before having sex again. That way, they avoid becoming reinfected.
The treatment is simple. I mean, for most guys, you give an injection and they're pretty good. The part that I don't like about gonorrhea is it has the potential of causing chronic infections. It has the potential for causing scarring along the the tract of the reproductive organs, and unfortunately, in some men and women, this can lead to infertility. Because along the sperm cord, if there is infection there, and the scar can cause closing or it can cause obstruction of the tract and can cause difficulty for sperm to get out, and for ladies as well. I mean, there are lots of ladies out there, or couples out there who have infertility issues that can very well be as a result of infections from gonorrhea sometime down past in their lives, and not just gonorrhea, other types of sexually transmitted diseases as well.
Women and men who are at risk should agree to be tested regularly. Talk with a healthcare provider about how often a test should be taken. Chlamydia is another common sexually transmitted disease. It can also spread from a woman to her fetus during birth.
In medicine, wherever we see gonorrhea, we automatically assume that chlamydia is also there. They always tend to kind of happen together. That being said, the transmission is the same. It's through sexual contact in all forms of sexual activity. So that means any part of your body that that is involved in sexual activity can have these things.
Chlamydia often has no symptoms. Most people are not aware that they have the infection, especially women.
Men might have the urethritis, as we said, which is pain and a burning sensation or a funny sensation in the penis. Ladies may also have some form of pain and burning sensation and inflammatory changes and so on. And again, chlamydia can also lead to scarring and infertility. So much of what we said about gonorrhea can be said about chlamydia as well. As a matter of fact, it is normal for doctors to treat chlamydia in every gonorrheal patient.
If any of these symptoms are noticed, get checked by a healthcare provider. Because chlamydia has few or no symptoms, it can sometimes go untreated for a long time. If left untreated, it can become a serious health threat, even affecting a woman's ability to become pregnant and causing men to become sterile. To prevent any kind of complication, it is important to get tested immediately if signs or symptoms are noticed, or if there has been exposure to the disease. Chlamydia can be treated with antibiotics. Healthcare providers will help decide which is the best treatment for each individual. Syphilis is spread by contact with syphilis sores. Direct contact can occur during vaginal and anal intercourse, oral sex, and kissing. Fluid from sores or blood may be tested to confirm a diagnosis of syphilis. If left untreated, serious damage can result to the nervous system, heart, brain, or other organs, and death may result.
Unlike things like chlamydia and gonorrhea, where it is possible for us to knock it off, syphilis is a lot more difficult to knock off. In fact, syphilis can stay with you for almost all of your life. And this is why it is normal for any pregnant person in Grenada to be tested for syphilis. Because if it is possible that the person is syphilitic, we have to expect that the fetus or the baby would be under severe amount of risk of dying in utero or dying during birth or having serious complications as a result of syphilis infection. So syphilis is one of those things that I really don't like because it's difficult to deal with. As an adult, you will have to go through long antibiotic treatments, repeated testings to see if you still have it, because like I say, it stays with you, and as you live longer, there are different levels of infection that can happen. In fact, we have primary syphilis, secondary syphilis, tertiary syphilis, just indicating the different levels of syphilis that can happen. Unfortunately, a child who is exposed to syphilis from his mother is at risk of developing serious malformations, serious problems with his bones, his eyes, his brain, all the sort of things can happen. And so this is why syphilis is really difficult. It's a difficult infection to get rid of, it's a difficult infection to treat, so the best thing is to try and avoid it as much as one can possibly do.
If at risk for syphilis, regular testing will help catch the infection at its earliest, most treatable phase. Practicing safer sex reduces the risk of getting sexually transmitted diseases. This may include using condoms, latex or plastic barriers when engaging in sex.
I'm not saying that condom is a magic bullet to prevent all sexually transmitted diseases, but condoms has been shown to limit the transmission of many sexually transmitted infections. So we have to face that the science is there, the numbers is there that shows us that this is happening. So the proper use of condoms is one way that people can limit the transmission of these things. I want to state here, however, that the best prevention is abstinence. Abstinence have been promoted for as long as we live. It is the only 100% surety. Let's not make no mistakes about that. If you don't practice abstinence, limiting sex partners is another way of limiting the amount and so on. But because we know what the prevention is, we must talk about what is facilitating people not be able to use these things. And one of the huge facilitator is behavioral habits and aspects. And alcohol is a huge one of it. Because people engage in harmful drinking, they get drunk, and they lose their objectivity and they're not able to think straight. And because of that, they expose themselves. So I think in preventing, one has to be careful about their behaviors. Almost all of these things are curable and treatable without causing complications. But if the risk of not testing is chronic pain, chronic disease, and worst of all, cancers or malignancies. So this is why it's absolutely important to get tested so that we can know exactly what is going on in there. If you do not test, if you do not prevent, 30 to 48% of your household income will be put towards healthcare cost. And it's worse in the lower socioeconomic status. So people who are poorer actually pay more money for healthcare out of the household income than people who are richer. People who are richer pay only about 20% of the household income in healthcare costs. So what I'm saying to people here is that not only would testing and prevention gives you a better life, but it makes you much more financially able to sustain your own life and your own household and your own self. It's a win-win situation for everyone because it costs so much less to go and get a check than to go to doctor when you're sick. So this is the point I want to leave with people. Test yourself. Prevent your disease so that you can enjoy your life and the little money that we all make at the end of the month.
Consult healthcare providers at any health center or medical station for more information.